Hey guys, it's Dave coming at you today to have a discussion about marijuana with THC or even CBD, which is any of the oils that you may be using or creams. There are several drug interactions that you need to know about that can occur with these products. The CDC actually says that in America right now, 1 in 5 people are using marijuana or CBD. In a lot of states, it's a free for all. You can use marijuana recreationally, medicinally, doesn't matter. Some states, it's for medicinal purposes only. In other states, you cannot use it at all, but maybe CBD creams and oils are legal, like in the state of Nebraska. I want you to be aware that even though it's legal, even though maybe you use it once a month or once a week or hardly ever, but I do it, at a party or something like that, or maybe when my knee hurts, I put some CBD oil on it. There is a risk of side effects with certain medications. There is a system that we all have called the cytochrome P450 system, which is a substrate made up of several enzymes that help break down medications and clear them out of your body. Sometimes the enzymes in the P450 system actually help to activate the medications so they're in their active form so that your body can then use them. All of us have different cytochrome P450 systems based on your genetic makeup. This is why we found out a couple of years ago that Hawaiian people or people with Pacific Island descent actually don't utilize clopidogrel or Plavix the way that it should be, and it's not effective in that population where it can be effective in other populations. We all react differently genetically to medications, and it predominantly is based because of the cytochrome P450 system. Well, THC, CBD, marijuana affects this system on top of your genetic makeup as well. So, if you're on antidepressants, antipsychotics, benzodiazepines, which are drugs for anxiety, like temazepam, clonazepam, alprazolam, lorazepam, among others, opioids, statins, which are cholesterol medications, so like atorvastatin, which is Lipitor, simvastatin, which is Zocor, rosuvastatin, which is Crestor, immunosuppressants, they can all interact with CBD and marijuana, creating more side effects and less desirable results. So if you're using THC, marijuana, and CBD, and you're on these medications, you need to let your provider and pharmacist know. It's very important. If you're on proton pump inhibitors like Prilosec, which is omeprazole, or Prevacid, which is lansoprazole, or Nexium, which is esomeprazole, you also are more prone to side effects. Antiepileptics, which are like phenytoin, which is Dilantin, phenobarbital, you're at greater risk for side effects. Warfarin, it affects your INR. So if you're on warfarin, you need to let your doctor know because you will be at increased bleeding risk. Or in some patients, it may affect you where it will not give you the results that you need and you're at a greater risk to be out of control so you could have a stroke or a heart attack. Montelukast is a singular drug that THC and CBD can affect. With montelukast, it increases your risk of side effects, which include mental health issues. So you want to be aware of that and let your health team know. Diabetic medications like glyburide and glipizide can be affected with that. Glimepiride is another one. So your blood sugar may be out of control when you're using marijuana or CBD, and this could be the result of it. So again, stay informed and keep your health team informed. Ritalin or methylphenidate or substrates thereof with ADD and ADHD medications can also be affected, giving you more side effects of those medications. So you could be, even though marijuana gives you the munchies, you're more hungry with it, Ritalin goes the opposite. It makes you not as hungry and can take away your appetite. So you could be playing a game of cat and mouse there, fighting side effects with that. Again, stay informed, keep your health care team informed. Now, there are some medications that CBD and marijuana can actually decrease the effectiveness of. And this is very important because these are medications that can keep your heart working correctly, keep your bloodstream flowing correctly so you don't develop clots, put you at risk of a stroke or a heart attack. These medications are like clopidogrel, Plavix, like I talked about earlier. CBD, THC, marijuana can decrease the effectiveness of Plavix. Pradaxa, Dagrtarban, which is a generic, they can decrease the effectiveness of that, which is very important to know. And then Zocor, Simvastatin, which is an for your cholesterol, high cholesterol, it can decrease the effectiveness of that. So you do need to weigh the risk and benefit of using marijuana and CBD if you're on any of these medications. More importantly, you need to keep your health team with your provider, your nurse, and your pharmacist informed of what's going on. I personally have had 2 patients that were on antidepressants and antipsychotics that I did not know they were using these products until I was informed by one of my healthcare team that they were. We had tried several different antipsychotics and none of them were working, but they were seeing bad side effects. Well, when we found out what was going on, we were able to inform their psychiatrist. We were able to put a plan together that enabled them to get on something that would help out, and still they were able to still use their CBD products. So the most important thing is keep your entire health team informed and involved so they know what's going on, so they can better assess things to help you out.